Are there any other form of appropriate or inappropriate care that people should be mindful of?
One of the areas that I see most commonly is recommendations about bone grafts. Filling in the sockets of an extracted tooth, the space that's left following removal of a root, is called guided tissue regeneration, or socket preservation. That's a valid procedure. I find that it's difficult, if not impossible, to add bone on bone unless you apply very special techniques that cost thousands of dollars. So generally speaking, following the extraction of a tooth, 6 months or so later, there's not much you can do except for these special procedures I'm speaking about, which would generally be more expensive than most consumers would afford. The other issue is on upper molar teeth areas in particular, where the sinus space occupies most of the available bone, as determined by x-rays, and patients are told they need sinus grafts or sinus elevation procedures. It's a procedure that I do commonly, but whenever I have the opportunity not to have the proposed to prescribe or perform the procedure, I do so. By that I mean the following. Especially in molar areas, the back root of the molar sits behind the sinus often. And even though the x-ray of the area may look like there's no room to put implants in without a graft, commonly I can take what we call the palatal approach and place an implant. So it's important for people, when they're asked by dentists to have this sinus graft procedure or bone grafts in general, to find out if there are alternatives.
Do a short version of that? Can you condense that into like a short version?
One of the most common areas of what I consider to be overtreatment in dental implants, or of dental implants, is the need for bone grafts. Generally, filling the roots after an extraction is a good idea. Other types of bone grafts are either inappropriate, from my opinion, or so expensive to accomplish that they're not worth considering. Frequently I can use narrow implants where patients are told they need bone grafts, and commonly when patients are told they need grafts in their sinus to make room for implants, I can actually place implants behind the sinus even though the x-ray looks like it's not possible. This is a procedure I call a palatally placed implants, and I do it frequently.